I'm going to be talking about induction. I'm just briefly hitting over this topic, not going deep into research for this video, but if you're interested in videos regarding research and induction, I will be posting those in the next week or so. So today I'm just going to be answering a few questions that I often get regarding inductions. The first one is, what even is induction? What does it mean when my doctor says I need to go get induced? Well, what it means is that he is saying we need to start your labor. It could be for a variety of reasons. Maybe it's elective. Maybe you want it done. Maybe your past due dates, like you're 41 weeks, 42 weeks, and we're worried about your placenta. Or maybe we're just worried about your placenta for another reason. Or maybe you're recently diagnosed with preeclampsia, or something's going on with the baby, or you have diabetes and the baby is, not doing great, or you're assuming it's super big, or anything. There's a lot of different reasons why induction could happen. So regarding your situation, I wouldn't know, but there are valid reasons to be induced in many cases. So when you're getting induced, what will happen is you will be admitted into the hospital. Your nurse will go over admission with you, ask you a bunch of questions, check on the baby, make sure baby's doing well. And depending on the method of induction, 4 different methods are Pitocin, Cytotec, Cervidil, and a mechanical balloon. So Pitocin goes through the vein, continuously is given to you, can be increased or decreased based off provider's orders or nursing judgment, and that just gets contractions going, and through that process can dilate and efface you, depending on baby's head and positioning. The second one is Cytotec. Cytotec is a pill that goes up into your cervix, gets completely absorbed, and dilates and effaces you. Through that process, it can initiate contractions. Sometimes they stay, sometimes they dwindle away. It really depends. Cervidil has the same kind of thing as Cytotec, but it's a little kind of tampon thing with a string, and it goes up into your cervix and it stays there until it is pulled out, depending on hospital, what they do. It could be 12 hours or some other amount of time. I don't know if hospitals differ on that. The next thing is the mechanical balloon. So that is like a little rubber thing. I think it's made out of rubber, don't quote me on that. But it goes up into the cervix, and when it's gone through the cervix a little bit, so it's really small. It's really, we're talking about super small. It goes through. So obviously you have to be a little dilated for this to happen. And then they will put fluid, they will put water into the balloon, and it will expand. So the balloon will expand above your cervix, and sometimes if they do it below your cervix as well. And what that does is it just puts a little pressure on your cervix to help start dilating it. And that stimulation of the cervix can also initiate contractions as well. And whether they stay or dwindle away will really depend on your body, how ready your body is, and if another medication is added or if Pitocin is then added. Depends definitely on what your provider, doctor, midwife is kind of doing, what your birth vision is, and how you guys have game planned it together. So I did kind of hit on the topic of why would I need or want it. Need because I mentioned earlier preeclampsia, diabetes for whatever reason, fetal distress. There may be some reasons why, or like growth restriction. There are some reasons. There's usually a list that a provider can give you or kind of inform you on of why you may need an induction at a certain period of time. Obviously, a common one is post dates, like if you're hitting 41 weeks, 42 weeks, a provider might be like, we're a little worried about your placenta. It's just better odds usually when your placenta is a little younger, or so on. So it really depends on what your game plan, how you've talked to your provider, who your provider is, what their comfort levels are, and what their experience and knowledge has kind of helped them through their practice. The reason want, Oftentimes there are elective inductions. They're pretty common actually, and those could be because you have family coming into town at a certain time, or your husband only gets off a certain time and it's already started, or whatever the elective reason is. There may be a few reasons why you might want to do it for scheduling purposes. It will be different being induced versus your body going into labor. So I may do a video on that later if you're interested in knowing what might be the differences regarding experience or medical wise in those situations. Please let me know in the comments below and I can totally do that. But anyway, so the summary of this is I went over what is induction. Induction is usually medication orientated in the hospital setting, or it can be unmedication orientated in a more home birth or birth center, midwifery setting. It looks like, either you're hooked up to Pitocin or you're gonna have some kind of medication. It really depends on your situation, where you're at. If you're home, hospital, birth center, it's gonna be very different. Why would I need or want it? I also answered whether it's elective or it's medically needed. You may need or want an induction. So I always recommend at the beginning of your doctor's visits, whether you first see them at 3 months or your midwife, you first see them at 3 months or you see them at 8 weeks, whatever the time frame is, sit down with them, talk about what their induction process looks like. Every doctor, provider, midwife are gonna have different experiences, kind of a different kind of pattern to how they do inductions. I mean, oftentimes they're similar, but sometimes they're different depending on the setting. So I would just ask them these questions, get familiar with what it would look like if you were to need one, because you may not know you need one until you're 42 weeks and then now you're post-dates and your provider's telling you you need to be induced and you weren't prepared for it. So I would just ask those questions on your doctor's visit and kind of get a feel if that is something you would be comfortable with, so you're not deciding later in your pregnancy. Anyway, so I hope this video helped you with your pregnancy, birth, learning journey. Justice says hello, and I look forward to seeing you in the next video. Bye!